Watch out, the words your doctor or physio use might actually be making your pain worse. Have you ever been told something like your spine is degenerating, your back is like a crumbling biscuit, or even you just have to live with the pain? If you've heard phrases like these from a doctor or therapist, it's time we talk. Because the language used in healthcare, especially around chronic pain, isn't just talk. It can shape how your brain and body experience pain, for better or worse. Hi, welcome to NxHLife. I'm Antony Lung, and I help people move from pain to peace using science-backed strategies for long-term recovery. Research shows that the way pain is explained medically and socially can actually affect the pain itself. Our nervous system is always listening. And if the message is danger, breakdown, or doom, it reacts accordingly. Pain is not just a tissue issue, it's a brain and body experience. Words like wear and tear, instability can trigger fear and helplessness, even when imaging or diagnosis doesn't reflect that severity. This fear often leads to movement avoidance, tension, and heightened sensitivity. So yes, words can literally make pain worse. Let's look at some common phrases used by healthcare professionals that might sound scary but are often misused or misleading, such as degenerative disc disease. Sounds awful, right? Like your spine is falling apart. But in most cases, it's just a normal part of aging, like wrinkles on your skin, and it's not a death sentence. Something like, you've got the spine of an 80 years old, whether you're 30 or 50. This is a terrible way to describe imaging results. Imaging rarely predicts pain severity, and comments like these can make people fearful of movements. Other common ones like slip disc or out of alignment. Discs don't slip, and your spine doesn't pop out like a Lego block. These ideas create panic and often lead to unnecessary treatments or surgeries. We can't fix you, so you just have to manage. While honesty matters, there is a difference between being realistic and being defeatist. There's always something you can do to improve your quality of life, even if the pain doesn't completely go away. When your doctor says something threatening, your brain picks it up on that as a danger signal. This activates the amygdala, the brain's fear center, and heightens your nervous system threat response. The results? More muscle tensions, more inflammation, more pain. This is known as a nocebo effect, the opposite of placebo. It's when a negative expectation created by language or belief actually makes symptoms worse. It's not all in your head, it's in your nervous system. So what should healthcare professionals say instead? It's not about sugarcoating the truth. It's about using language that empowers rather than frightens. Such as age-related changes are common, often not painful. Your body is adaptable. It can become stronger through movement. Scans show some changes, but they don't tell the full story about your pain. Clinicians who use positive, realistic, and reassuring languages tend to see better outcome because they help people feel safe, confident, and hopeful about recovery. If you've been told something scary in the past, it's okay to question it. You can ask your clinician, what does that mean for me right now? Is this something I should be worried about? Is this something that could improve with time or movement? And if a practitioner consistently uses fear-based, passive languages, it might be time to find someone who supports your recovery. Through education, movement, and empowerment, pain is complex, but healing is possible, and it often starts with words we hear and believe. You deserve a care team that sees not just your scan, not just your diagnosis, but the whole person behind pain. Curious how your brain, body, and belief all plays a role in pain? So join our free 5 days mini course. You'll find the link below. Get practical tools, real answers, and a fresh path to healing. And if this video helps you, don't forget to like, subscribe, and share it with someone who might need a second opinion on their path and the words they have been told. I'm Antony Lung, and I'll see you in the next video.